we going? Here we are. Hey, all right.
That
Look at
is
my
crazy.
hat.
No, your hat is crazy.
It's like
It's not your.
fading into
It's
the.
not your.
See that? I
It's
do
not your.
have. Yeah. Huh?
It's not your hat that's crooked. It's your head.
Oh, that's what it is. Let's see. It's kind of hard to do, and it's like not a mirror. It's the opposite of a mirror. So
Yeah.
look at that. I got a cool hat, though, don't you think? Barton Nutrition. And I'm representing the South Dakota State University Jackrabbits, who are in the football college championship game this weekend. So got to represent. And that's where my son Carson is going to be attending college this next fall, as he just graduated high school, or is about to, I guess, technically.
But I
So
do feel bad that he didn't make the better decision to go to the University of South Dakota. I feel like that would have been wiser.
Boo.
But you can deal with that for the next 4 years.
We do a foster kids camp every summer, and we usually bring them to the SDSU football field, and they meet with some players and coaches. And my camper a few years back, it was pretty funny. He's like 9 years old. We're on the SDSU football field. It's just like this glorious like stadium and all these players, and my little camper yells out, "Go Yotes!" And the Yotes is the rival USD college team. So they thought that was hilarious. So that was good. Well, welcome everybody. We whenever we get Dr. Saunders on early, we usually start the webinar a little bit late because we get chatting and stuff. So
and it's my fault because I haven't been on for a week, so I had to catch up with my friends.
So today so welcome to the Fixed Blood Sugar webinar, everybody. I'm Joe Barton with Barton Publishing and Barton Nutrition, and we've got Dr. Scott Saunders as well as Leslie Prinz, the star of the show, as Chris likes to call her. And today we're going to be talking about, type 2 diabetes and blood sugar, but also this week's topic is actually going to be pliability and flexibility and preventing injuries. And I don't think we've ever talked about this subject. So I've also brought in a special guest. Tom Brady will be joining us today. You may recognize Tom as the 7-time Super Bowl winning quarterback for now the Tampa Bay Buccaneers, formerly of the New England Patriots. But pliability is today's topic, as well as blood sugar and diabetes. So the purpose of this webinar, of course, is to help you on your journey of reversing type 2, going through our program of the Diabetes Solution Kit that hopefully you have a copy of. And this is the program where we talk about the basics of type 2 reversal: 20 grams of carbs per day or less, 6-10 reset, which means going to bed on an empty stomach at 10 o'clock at night so that your body can reset itself optimally. 3, lower your stress. So we get a lot of questions on, why is my blood sugar higher in the morning, or why is it higher and I've been eating good? Well, it might be your stress. Number 4, minimize your sweets, even if it's like stevia or especially artificial sweeteners. Those things may not have carbohydrates or calories, but they do affect your insulin levels. So that is a major factor in insulin resistance. High fiber. We've been talking about the importance of eating fiber. Taking care of nutrient deficiencies, which is why we have our supplement line, including our #1 bestseller, Synachroma, which is, hopefully you have that already because it's amazing. And measuring your blood sugar numbers, your A1C numbers, just so you know where you're at and where you need to go. And then celebrating your progress and being a part of our community and coaching. So that's why we're here. And I'm going to turn it over to you, Dr. Saunders. Let's get rolling. Let's talk about pliability.
Pliability. So one of the important things about exercise is preventing injury. And one of the things you do to prevent injury is to warm up. And one good way to warm up is stretching out. In fact, there have been several centenarians, people who live over 100 years, who actually don't exercise every day much at all, besides walking and gardening and doing stuff. And what they do is stretch every day. Stretching keeps your muscles able to work better, and your tendons and ligaments work better, and your joints fit better, so your joints work better, and everything functions better if you can stretch them out somewhat. What's really interesting, just yesterday I had somebody in my office. She is 14 years old, and she has a syndrome. We figured out that she has a syndrome called Ehlers-Danlos Syndrome. So if any of you can take your thumb and touch your wrist or your arm with your thumb on the same side, Joe, then you may have this stretchiness. There's many different kinds, but those people whose joints are called, we used to call them double jointed. About 1 in 5,000 people have it, and it's not a disease per se, but there are I think they have up to 13 now different genetic markers for it, because what it does is it makes your collagen less stiff, so that doesn't hold really well, and you have more elastin. So that means joints move easily, and you can bend your finger all the way back to your arm, and people can put their leg over their head, kind of thing, and you see people like that, and that is actually a genetic anomaly. It's not normal. So those kind of people, those 1 in 5,000 have that, should actually not do stretching exercises. You don't want them to overstretch to pull their ligaments, tear them, or make their joints too mobile, because that's what'll happen if they do too much stretching. So it's better not to do stretching. And if they're careful, they can do stuff like yoga. But they have to be careful with yoga and do the right kind of yoga. They can't just do stretchy yoga. So that's one group of people that has a genetic anomaly. There's the rest of us, however, often what we need to do is continuously stretch out. Why? Because over time, our ligaments are all, they shrink. So they shrink over time. If you've ever seen somebody that has paralysis, they get what are called contractures, where, if their left hand doesn't work, let's say they have a paralysis of the claw hand deformity, what's it called? The ulnar nerve. So if the ulnar nerve is paralyzed, and that's the funny bone, and you mess up that nerve, what happens is you get this where these 3 fingers work, but these 2 don't, and they instead of being stuck out like that, they start shrinking in and they go like that, because over time everything in our body shrinks down, and it keeps us tight. Our skin will shrink down, everything will shrink down, keeps us tight. And that's great, because it keeps your joints where they're supposed to be. But then over time, if you don't use something, you're going to lose the ability to do it. So you'll lose function in it. People who lay in bed for long periods of time lose the ability to get up and walk. We have somebody in the nursing home. She has contractures of her legs. She can't get out of her wheelchair because her knees are bent, and they won't straighten out. It's going to take a long time of stretching to straighten out. So to maintain function, is one thing you do is stretch. You don't have to stretch every day. Those of you who are dancers will know that you have to stretch regularly to keep your flexibility, and that's what allows your joints to function properly, is using full range of motion. And even increasing range of motion. So if you can grab your ankles or put your palms on the floor, you're doing great. If you can stand up straight with your knees straight and put your palms on the floor, that's great. Yeah, Joe,
I better change the view here so that everyone can see Joe.
All right, here we go. You can't see the floor, but I can get like this.
That's pretty good, Joe.
Pretty good. My hamstrings are a little tight.
Some of you may know I just had ACL surgery last week, and I have to be able to like put my shoes and socks on, which is very difficult when you have one leg that is completely straight. And my husband watches every time, and he's like, if something happens to me, I won't be able to do any of this stuff. Like because he can't stretch that far. So it's kind of funny that you're talking about it. Yeah.
He's inflexible. I didn't know that. Well,
yeah,
I saw you put your shoes on the other day, Leslie, and I was quite impressed.
Well, and I have to sit in the back seat of our vehicle as well. So I slide in and then I have to lift my leg all the way up over the seat in front of me. So it's amazing what you can do.
That's good.
When you have to.
Mm-hmm.
Yeah. So the idea of being flexible is to maintain use, to be able to do all of the stuff that you need to do to function well in life, and doing it on a consistent basis is something that helps you to maintain flexibility, maintain full range of motion in your joints, keep the joints functioning properly, because the joints actually work better when the right ligaments are stretched out and the right ones are holding in place, to keep everything locked in their proper place. So that stretching is important, and you can do simple exercises. If you think about it, yoga is like stretching exercises, range of motion stuff. You're doing poses that give you full range of motion. Tai Chi is another one that you're doing a lot of range of motion to keep everything flexible and functioning.
Mm-hmm. Something that Tom Brady mentioned in his book that I thought was interesting was blood flow, and that we could talk about blood flow, but like it said, the same blood that goes into your brain is also circulating through your whole body and into your feet and toes and all around. So keeping that blood flowing is important, but that's an interesting concept. How important is blood flow, especially with someone? Let's try to blend it into somebody that's got blood sugar issues. How does high blood sugar affect blood flow?
Oh, that is really important. And that is the key to all of the problems of diabetes. So what are the problems of diabetes? Your eyes don't work. Your brain doesn't work. Your heart doesn't work. Your kidneys don't work. The nerves in your feet don't work. Why do they stop functioning? Why don't they work? It's all about blood flow. It's all about getting enough of energy to the systems, the different organs of your body, by having sufficient blood flow. So if you don't have enough blood flow, then especially your nervous system, especially all of those organs, they really suffer. And people who have numbness in their feet, for example, that's dangerous, because you don't know if you have an infection, and you get just a little ingrown toenail or something, you don't know you have it, and it gets infected and gets worse, and then it gets into the bone, and you're going like, well, I didn't even know it was there. I didn't feel anything. And that's the problem. It's not, part of it is you get infections easier because you don't have good blood flow to clean out the infection either. So that blood flow is essential. So one of the things that we formulated the Nervala supplement for was for improving blood flow. So there's something in there called benfotiamine. Benfotiamine is a vitamin B1, but it's fat-soluble vitamin B1. So it can get in through the cells, the lining of the blood vessels, and it repairs the lining of the small blood vessels, so you get better blood flow. So yeah, blood flow is essential. That is really ultimately, that's the most, well, not the most, but yes, without blood flow, nothing's going to work.
Well, that seems like a good segue for me to do a little mini commercial here. Seems how this is a free webinar, but we got to have some sponsorships, right? So let's see. Boom. Where's the lighting here? You can't really see it. Nervala. Hello? Can you see that? Okay. So tell us, so it's got benfotiamine in it, which you just talked about, and it's got alpha lipoic acid. So how does this help somebody with diabetes or blood sugar issues?
Okay. It's not that it helps the blood sugar. You still have to control the blood sugar. You still have to eat right. You still have to do your phase 1, get your blood sugar down between 70 and 70 and 90. You still have to keep everything functioning well as far as the blood sugar goes. But what the Nervala does is repairs the intestines and the nerves so that the nerves function better. It actually brings back the function of the nerves. So people who have had tingling, numbness, weakness, the nerves actually come back and they start functioning again. And we've had a lot of people come back and say, "Oh, I've been taking the Nervala for 3 months and I'm back to normal." My patients all the time. If somebody has, even if they don't have diabetes, if they have neuropathy, like for example, we've had a lot of people with both who've had COVID-19 and then the vaccine. People with COVID-19 that have had nervous system problems, and people who got the vaccine who then got a nervous system problem. Yes, the other day I had somebody who had itching. She said, like a tingling itching from her ear all the way down into her eye and her nose and down into her arm. And so we looked at all the possibilities, and it's probably because of the vaccine. So what do you do to repair the nerves? Same thing. I had another guy, a nurse at the nursing home, got Bell's palsy from when he got the vaccine. And what did I do? Gave Nervala. Because there's 2 things in there. One is to improve the circulation, and that's important. But the other part is that alpha lipoic acid that improves or gets rid of inflammation. It's really mostly an anti-inflammatory, but it also helps the mitochondria to make energy more efficiently. So on the one hand, you get more blood flow. On the second hand, you get more energy production or increased or improved energy production.
I was just thinking about how it's important that we feel pain. Like you said, like imagine you get an ingrown toenail or whatever. Like if you don't feel that pain, like you don't realize that there's something wrong and that you need to do something about it. So as much as we complain about being in pain, like I would say, thank God for that pain, because it's a signal that something needs to be fixed. So it's an interesting concept.
Yeah, well, I thank God for pain because I don't have any right now. But Leslie?
I don't think you want me to unmute myself right now. I'm just kidding.
Yeah. Well, so let's talk to Leslie here. So she is recovering from ACL surgery. You had, what was it? A partial or full tear of your ACL and MCL, was it?
Okay, so I had a partial tear of my MCL and then a full tear of my ACL. And then I dislocated my patella as well. So I had that surgery last week for the ACL, and I've been doing therapy now. Which I don't know that I've ever done physical therapy before. And it's so good. It's not always fun, but it is really good.
Yeah, it's probably painful, like getting those muscles to re-engage and to stretch again, right?
Yeah, it really can be. But it's amazing how quickly you see results from doing those things, from stretching, engaging your muscles. Man, I keep thinking, I feel like I should have been doing physical therapy my whole life. There's just so much good stuff that comes from it. So it's a very timely webinar for me.
Yeah, well, good. Yeah, it's interesting when you do new activities and use muscles that you haven't used in a long time, how sore they can get. And so I think, anytime you can do any type of pliability, flexibility, yoga. My wife teaches water aerobics. That's a good way to really get a lot of your muscles moving and warmed up, and all of that helps to prevent injury and just stay flexible, especially as we age and all of that. So Hello. Okay, today's Fixed Blood Sugar webinar is sponsored by Easy Relief Magnesium Spray. Now, this is fast absorbing magnesium that is a topical spray that you spray on your skin. And it is vital for over 300 functions in your body. Now, the nice thing about this magnesium is, first of all, you don't have to ingest it, so you can't take too much of this. Your skin is great at absorbing only what it needs. So you spray about 30 to 50 sprays of this per day, and I personally do it 2 to 3 times a day of 10 to 15 sprays, and I do it on my chest and my legs typically. And this is going to correct the deficiencies that most people have. Now, how do you know if you need magnesium? Usually the symptoms are you have muscle cramps, trouble sleeping, if you're fatigued, if you have erratic blood sugar, if you experience any type of numbness or tingling, or if you feel down in the dumps or feeling blue. Now, those are all different types of symptoms that a lot of times magnesium can help with. So, highly recommend this product of Easy Relief Magnesium. It is super easy. You spray it on. You don't have to take a pill or anything like that, and you don't have to worry about absorbing too much. This absorbs quickly. Now, this will get into your body in less than 2 minutes, into the bloodstream and circulating through. So it's a lot faster than if you take a pill with magnesium in it. So it's super important for metabolism, metabolic function. If you have insulin resistance, magnesium will probably help with that. There's a connection between low magnesium and insulin resistance. It's great for relaxation and sore muscle relief. It helps you sleep. Great for muscle cramps and achy joints. There's no sticky residue. So a lot of times if you find a different magnesium spray, it's not bonded with water like this process has done. So this doesn't leave a sticky residue at all. So it's great. It doesn't sting. It improves your mood. And there's just all sorts of different, again, there's 300 different functions that magnesium is used in the body. Highly recommend it. It's 365-day guarantee, just like anything. You can get it at bartonnutrition.com. And if you want to save 25% in addition to our already discounted prices, use this coupon code webinar25 as a coupon code. Again, that's at bartonnutrition.com and Easy Relief Magnesium. Highly recommend it. Dr. Saunders approved. It's all natural and safe. Get yours today. All right, thanks. Now back to the webinar. Well, we are getting close to that time where we like to take your questions. So if you have any questions regarding this topic or diabetes or blood sugar or high blood pressure or anything really that's related to any health challenges that you're facing right now, just put it in the Q&A section here in Zoom, or if you're on Facebook, put in a comment and we'll get that, and we'll be checking the chat as well. So we've already got several that have come in, so I wanted to make sure we leave enough time to get to all these. Let's do a little bit of housekeeping too as we give people a chance to ask their questions. So bartonwebinar.com is the website that we like to direct people to. That is where we have, so if you're watching this on YouTube, you can actually join us live as a Barton Publishing customer and register to join us on these Zoom calls. We've got limited seating, so get registered and then you can join us every Thursday at 11 a.m. Central Time. We're going to be doing a low carb cooking show. Hopefully next Tuesday, we're going to record that with Dana, our friend who is just really good at finding creative ways to eat low carb and yet also eat delicious foods. So that should be, we're not going to go live on that one. We're going to do a kind of a trial run and then post it to our YouTube channel. So make sure you're subscribed to our YouTube channel, and you can find that on bartonwebinar.com as well. And our Facebook page as well is linked there. So community is important. We want you to be involved with other people on your journey, because there's a lot of people going through the same thing together. And as the African proverb says, if you want to go fast, go alone. But if you want to go far, go together. So that's why we're here together. And Leslie's slowing us down anyways with that, you know, that knee under repair right now. So we can't go fast, but we will go far together. So, all right, let's get to some questions.
All right, I had a couple emails come in. Those of you who are asking about the videos for the coaching videos, the diabetes coaching videos, I have emailed the person who's giving you access to that, but I want to check and see if you'll get a notification because I may have missed that. So I'm checking into that for you, just so you know. Okay, I had a couple questions I think that came through email, and I apologize for my delay. In my mind, I was going to have surgery last week and be able to function totally fine within a few days, but I was wrong. So I'm getting caught up on some of these emails. But here's a question from Michael. He's wondering if it's okay to drink kombucha, and he drinks remedy kombucha with no sugar. It does have stevia added for sweetener, but a very small amount.
Okay, by itself, it's okay. However, when you're on the phase 1 of the program and you're trying to get your blood sugar down to 70 to 90, 4 to 5 if you're on the Canadian program. If you're trying to get your blood sugar down, then one thing that we've talked about a lot is avoiding the taste of sweet. Generally, kombucha is okay, unsweetened if you use kombucha without any sweetener. Stevia, we talked about that a lot. Any artificial sweetener has potential issues. Some people don't respond to it as much as others. Some people release a whole bunch of insulin, and the artificial sweeteners cause insulin resistance, which has been proven in multiple studies that any kind of artificial sweetener, doesn't matter what it is, it's the taste that causes the problem. So I have that a lot in my office when I talk to people about, okay, this is what you need to do, and then they always go to, where's the line? Well, how far can I go? How about a mango? Can I have a mango? Well, you can have a mango, but you know, that's going to be, you can have half a mango. That's 20 grams of carbohydrates right there. There's a lot of sugar in mangoes. And then they go, well, what about, you know, I need my coffee. Can I have my coffee? Yeah, as long as you don't put any sweetener in it. Oh, there's no way I could drink without sweetener. So, you know, there's always where's the line kind of questions. And if you can turn your mind around and look at it the other way and say, okay, how far can I go? What's the best way to do this? How can I, what if I did 10 grams of carbohydrates a day? Would that be even better? And the answer is, yeah, actually it would. That would work really well. So the kombucha question, it may be okay, but if you find that it's impeding your progress, then you may need to avoid that as well.
All right, good stuff. Here's a message from Julius. Julius is asking, what would the impact of taking metformin for 25 years be?
The impact of taking metformin for 25 years. Well, it depends on how much you take, of course. It is a toxin. It does inhibit the mitochondria to some extent, their ability to use sugar. So it kind of forces the fat to be used for energy, which is a good thing sort of in the beginning when you're just trying to train your body to burn fat. It may help. I don't know, you know, I look at the other research on it, like with cancer, and it does seem to inhibit cancer. So 25 years, I don't know, maybe, I mean, there's plenty of experience of people who take it for 25 years. I mean, but I can't think of any research. So if I look at my own experience with patients who've been taking it for, you know, 20 years, 25 years, they aren't any better, they aren't any worse, particularly. I don't think it I don't think it's particularly bad, but it doesn't make them better either.
Okay. Here's a question from Meg. Can we talk about butyrate? Is that how you pronounce it? Why it's important, and other than butter, where it is found?
Oh, wow. Okay, butyrate is a short chain fatty acid is what it is, and it is anti-inflammatory, and most of it doesn't come in your food. There's small amounts in food here and there, but butyrate, most of our butyrate is made by our bacteria. There's certain groups of bacteria called firmicutes that make this butyrate, and it's really important. Butyrate actually lowers inflammation, helps your brain function better. So whoever asked that question is really intelligent about, yeah, butyrate's important. I had somebody that had chronic colitis, and he was taking Butyrate Enemas because to calm down his intestines and to get his system, get the inflammation down in his system. There isn't really a good food source. You can take pills of butyrate, but ideally having good bacteria, the good bacteria in your intestines. So feed the good bacteria with a lot of prebiotics, and that would be fructooligosaccharides. So fruit, vegetables, beans. If there's one food associated with longevity, it's beans. They're just great. They have the right kind of fiber in them, and whoever made beans just did a good job. Whoever invented beans.
Hey, speaking of beans, I found a pretty good snack. It's called Bada Bean, Bada Boom, which I like saying, but these are pretty tasty. There you got several different flavors. This little snack size, it's got 15 grams of carbs, but it's also got 5 grams of fiber. So 10 net carbs and 7 grams of protein. So it's pretty good.
Wow, 10 net carbs? That's not, that you can't eat very much. That's only like, you can have 2 bags. That's it for your whole day.
Well,
carbs.
That's all you need. They're satiating, so you feel pretty full after this. 3 grams of fat. But what are broad beans? Broad beans / fava beans? Fava beans?
Fava beans, yeah.
I've never heard of those before. Is that like a California thing or something?
Oh, no. I think they come from the Middle East. Yeah.
Okay. Now follow up to our last question. We're having a lot of jokes about butyrate, so we'll just keep calling it that. I'll probably never be able to call it anything else. So I am happy that I can say all these words for you guys. So we have a question. Now I lost it here. Let's see. How much does I see now he even wrote it as butyrate, and now I can't even read it without laughing. Oh boy, here we go. Okay, how much does it raise a cause in blood sugar?
How much does it raise what?
How much does it rate? Oh, I'm sorry. Okay, not that I'm concerned, but how much does butyrate cause a rise? I know he wrote butyrate.
Okay.
Cause a rise in blood sugar.
Oh, butyrate shouldn't. It's a short chain fatty acid. I don't think it raises blood sugar at all. It's not a carbohydrate. Well, it comes from carbohydrates, but it's made into a short chain fatty acid. So I don't think it should cause a rise in blood sugar at all.
Okay.
Yeah. I don't know.
Okay. A question from Mike. So I'm about to get my A1C checked in about a month after 3 months of careful dieting. So my question is, can I ever eat a product with dextrose or maltodextrin, etc., when it's in the ingredients? And then he has another question too, but let's address that one first.
Okay, so the dextrose is glucose. It's the dextrorotatory glucose, and it's just a way of saying it's another sugar. It's just sugar. And it's interesting that there's two different kinds of glucose. One is the right-handed one, which is dextrose. Dextro means right, and then the other one is levulose. Levulose is left-handed. And we don't use the left-handed one, the levulose. We actually use the dextrose. So it's just glucose. There's nothing magical about it. So yeah, you can eat stuff with dextrose in it, but remember that's part of the carbs that you're counting. So that's going to go into your 20 carb thing. And what was the other one? The dextrose. What was the other one? Was
Maltodextrin.
Maltodextrin. Yeah, maltodextrin is actually a starch. It is something we can digest, so it can raise your blood sugar. So those are things that if it's in the ingredients, you can eat it, but it might raise your blood sugar. So that's one of the things when you're in phase 1, avoid them. But when you're in phase 2 and you eat something that has it in there and you go, oh my gosh, my blood sugar went way up, then you might want to avoid that.
Okay. The next part of his question is also, why does stevia spike blood sugar? And if so, how much? My A1C is 5.6. When I'm only using stevia every day for any sweet foods and drinks, there's no information online about stevia. I've looked.
Yeah, I know. There's been some research on it though, and it doesn't raise your blood sugar. That's not the issue. So I want to make that clear. Artificial sweeteners do not raise your blood sugar. They make you more insulin resistant. And that's the difference is, so because you're more insulin resistant. So for example, people that drink diet sodas, what they found was they gained weight a lot more than people eating sugar sodas. And they're like, what the heck? This diet soda has 0 calories and people are gaining weight on it. And this one that has, 17 grams of sugar or 70 grams of sugar in it, people aren't gaining as much weight. It just doesn't make any sense until they figured out the insulin resistance, because insulin is the hormone that causes you to hold on to fat on your body. So it's not that stevia raises blood sugar. It's that it may, in some people, tend to make you more insulin resistant.
Okay. It looks like we have our friend Chris on here. I think it's Chris, I'm assuming. He says, sorry if I missed it. Did the doctor recommend a book on stretching?
A book? No, I didn't. I don't have a book on stretching.
This is a good one. Yeah. I recommend this. This is really good. It's got a lot of like stretching and all sorts of stuff. So the TB12 method. Don't buy his supplements though, buy ours instead. But no, this guy, he's won 7 Super Bowl rings. He's only got 3 fingers left to fit 3 more rings, but he's like 44 years old, and they do have good stuff in here. So I do recommend that, but we may have to come up with our own that's better.
There you go, the book.
Yeah.
All right. Freda is wanting us to talk about magnesium. Not sure. It says make it easy and what makes it work.
Okay. So magnesium, what a wonderful subject. Okay. Let me tell you about magnesium. It is essential for a lot of different enzymes, like 300 enzymes in your body require, or more than 300 enzymes in your body require magnesium to function. So if you don't have enough magnesium, there's a lot that can go wrong. And so you can't say, oh, a magnesium deficiency causes this, because it does all kinds of things. Your energy systems don't work. Your immune system doesn't work. You don't heal well. There's just nothing works right. Your immune system won't work. Nothing works right if you don't have enough magnesium. So it's so important. And then if you think about, like in the United States, we have no food that we eat that has a lot of magnesium in it. And I'm talking about staple foods. So magnesium is found in significant amounts in nuts and seeds. We don't have staple foods. Some people eat peanuts sometimes. Okay, fine. but it's not like this is what we live on every day. Nuts and seeds, whole grains, green, anything green. And beans are included in the nuts and seeds, right? Because you can grow a bean, right? That's a seed. So beans, peas, lentils, all of that kind of stuff. Those and anything green. So spinach and kale and chard and all that stuff, and all the green stuff is green because of the magnesium. Magnesium is found in the chlorophyll of the plant, and it's like, oh, it's really cool. I got to tell you about this. It'll make you believe in God for sure if you don't already. The hemoglobin molecule that we have in our blood that has iron, that brings the oxygen to our bodies, is the same molecule that the plant has that has magnesium instead of iron to make the oxygen that we need for our bodies. Whoa, isn't that weird? So that molecule is what takes in the magnesium, is what takes in the power, the energy for the plant to take the carbon dioxide and make its structure and then give off oxygen so we can breathe. And then the oxygen comes into our hemoglobin that has iron, same protein structure with a different metal in it, and that's all. So we have iron, they have magnesium. So when we eat the plants, then we get magnesium. So if you live on green vegetables and nuts and seeds and beans, peas, lentils, then you're going to get magnesium. But think about food. What do we eat? We eat meat and processed grains, like a hamburger. Hamburgers, no magnesium in it at all. French fries don't have magnesium in them, or significant amounts. So we need magnesium, and a lot of people in the United States are deficient in magnesium. And if you don't have enough, then things don't work right, whatever that things are. You could have cramps. I saw somebody in my office the other day, and the eye, you can just see the little muscle in the eye to go twitch, 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 twitch. And I'm going, your eye's twitching. He goes, oh yeah, it does it all the time. I'm like, dude, you're deficient in magnesium. You got to get some magnesium. So magnesium is very, very important, and it's a very common deficiency. So how do you get magnesium? So for supplementation, number one, I would recommend eating it in food. So eat greens, nuts and seeds, beans, all that stuff. So that would be a good way to get it. But if you're supplementing, don't let people talk you into this magnesium is the best and that magnesium. Yes, it's true. You get a better absorption with certain chelated magnesiums, but you know what? Magnesium oxide is pretty well absorbed too. Magnesium citrate is pretty well absorbed. So taking magnesium on a regular basis is fine, but you have to be careful, because if you take a large dose of magnesium, they were giving people a gram of magnesium and measuring, they drew their blood and measured how much you absorbed actually that you get into your body. And over time, the amount of absorption decreases. Within 90 days, they only had 30%. They were only absorbing 30% of the magnesium they were taking. So it's really important that you don't take magnesium every day. It has to be an intermittent thing. How many times? Well, take it for 1 week and then off for a week. Take it every other day. Take it on some schedule that's not every day. If you take about a few days off, then your body starts going, I need some magnesium. But if you take it every single day, then you downregulate the ability to absorb that magnesium. So,
this, you spray it on your skin.
Oh,
so how does that work?
Right. So if you spray it on your skin, you don't have to worry about that absorption problem. So that's why we have the spray called magnesium oil. It's not really oil. It's just a concentrated solution of magnesium. And you can spray it on your entire body, and it'll absorb through your skin at a certain rate. Everybody's a little different. It doesn't absorb the same for everybody. And if you put it on a small area of skin, then you get less of it. And if you put it all over, then you get more of it. it's a good way to get magnesium, and you can't overdo it if you use the spray. And if you take it intermittently, you can't overdo it either. If you're taking it or an oral supplement, either way.
Each spray of this has 22 milligrams of magnesium chloride hexahydrate, and it's in purified water. So it's really good stuff. It doesn't leave that oily residue on your skin really at all. So good stuff. Highly recommended. I've been using this for years, and helps with it. If you have like restless legs or don't sleep real well, it helps with pliability. It relaxes and smooths your muscles, and 299 other things it's helpful for.
Yeah, that's a really good, that's an important point for people that have spasms of their muscles. The only muscle relaxant that works on the muscle itself is magnesium. All of the other muscle relaxants that they call muscle relaxants are not muscle relaxants. They work in your brain. They just shut your brain down. So you go, yeah.
Interesting. All right. Well, let's keep rolling. I know we have a lot more questions. So.
Oh my goodness. Yes, we do. All right. Question from Scott. I'm in a state of ketosis, and I take your healthy gut support, and I eat a salad every day. However, I'm still getting constipated, and I need to take a laxative once a week. Can you think of anything else I can do more regularly? No, I missed that. To go more regularly. There we go.
to have a Butyrate, daily Butyrate.
Oh boy.
Okay, that is a great question. So the answer is not for you specifically, but for general idea is this. Getting enough fiber and the right kind of fiber is different for everyone. Some people need to eat a lot of fiber. So eating one salad a day, you would be surprised how little fiber that is. If you have a dinner plate, a 10-inch dinner plate, and you fill the whole thing with salad, that's only about 4 grams of fiber. You need 10 of those to get your 40 grams of fiber a day. So the first thing to consider is how much fiber you're eating, and actually measure it and look at it and say, wow, an apple only has about 4 grams of fiber. A pear has about 5, so are you getting 40 grams of fiber a day? So if not, that would be the first place to go. And so what you do is you replace things that you're eating now that don't have fiber. So what does not have fiber? Well, anything that's made of fat. So like meat, cheese, eggs, milk products. Oh, and that's another thing I wanted to mention. A lot of people, and my patients, as I go through and people have these kinds of issues, when I take them off milk and cheese, they often get better. Often, not everybody, but very often. That getting off of the milk proteins is enough by itself to have them have regular bowel movements. So that may be something to consider. And then so replacing the things that are fat and protein with things that are fiber. One of the problems that people come up with is, well, oh my gosh, if I replace all of that stuff, then there's nothing I can eat because I can only have 20 grams of carbs a day. Remember, it's net carbs. You have a whole bunch of free foods you can eat. You can eat that salad. Yeah, you can eat 10 plates of salad if that's what you want to do, because those are free foods. You can have all the broccoli and cauliflower and spinach and lettuce and kale and cucumber and bell peppers. There's a lot of things that you can add in that have a lot of fiber that will ultimately add up to more fiber as you take out things that are low in fiber or have no fiber, like meat and eggs and cheese and milk products, cottage cheese, yogurt, all that kind of stuff.
All right. Here's a fun note from David. Took my blood sugar this morning. Amazingly, it was 91. Fantastic.
Woohoo!
All right.
And then right after that, we got another one here from Andy. Morning all, day 4 of phase 1, and I woke up with an 85 blood sugar level, and it's been in the Libre good range all morning. First time in a long time. Woohoo!
Awesome.
Love it. We love these messages, guys. Keep them coming.
This works. Hey, also, while we're here, this is what 5 pounds of fat looks like. So have fun burning this baby. You can do this in 5 days. If you eat that phase 1, this will be fall off your body. So motivation right there.
What did you say? This will be poop fall off your body. Is that what you just said?
Whoop.
We're going downhill here. We started this is what happens when we get together as a team too. It's usually me and the guys, and it just gets weird.
Yep.
Okay. Let's see. All these nice people saying good morning. You guys are the best. Okay, Krish. Hey, Krish. After breakfast, it says that's the second question. I missed the first one. Okay. So many people are afflicted with pancreatitis and the mortality is high. Do type 2 diabetics in particular, are they prone to pancreatitis?
Oh, good question. Sometimes. And part of the pancreatitis comes from having a really high triglyceride level. And so one of the things with insulin resistance is it blocks your ability to use fat for energy. So you're not using fat for energy, and so you're eating triglycerides, and they build up. And very high levels of triglycerides can induce pancreatitis. So that's an issue, actually. And you're talking about acute pancreatitis. And then there's chronic pancreatitis, where your islet cells, which are the cells in your pancreas that make the insulin, are dysfunctional, and then your diabetes gets worse. So it actually can work both ways. People with diabetes, if they get super high triglycerides, they can get pancreatitis. And then on the other hand, pancreatitis can cause them to get low insulin and type 1 diabetes. Yeah, it's a risk.
Okay. From Meg, is a garlic supplement going to help with blood flow?
Garlic is very good for thinning the blood. And by thinning, I mean decreasing clotting factors and decreasing the viscosity of the blood. So there are several things that do that. Vitamin E, garlic, and fish oil are easy to get. They work really well. And if you were to go to like a surgeon and you're going to have surgery, those are things that they'll tell you, do not eat these before your surgery, because you could bleed like stink. And we might have trouble controlling the blood if you're eating, fish oil and vitamin E and garlic.
Question from Connie. Have had a total hip and knee replacement, and since then I've had swelling in my lower legs, ankles, and feet. Have been given water pills, but that doesn't get rid of the swelling completely.
Yeah, okay. Water pills just make you dehydrated. That's what they're for. They cause you to pee out more than you normally would, so you're getting rid of water, so you're a little dehydrated. And so your body needs the water a little more, so you can't get that extra water in your lower extremities. So the surgery, often with hip replacement surgeries, or even knee replacements, there's only one vein there. There's one major vein, and if it's disturbed and the valves are disrupted at all, then you get extra pressure in the venous system. There's a couple of things you can do to help that. One is called Pycnogenol. Pycnogenol is French maritime pine bark extract. So pine bark has some bioflavonoids in them that decrease inflammation and actually help venous blood flow and have more tone in the veins. The other one is horse chestnut seed extract, which also has bioflavonoids that improve the blood flow and function of the veins themselves. So those are two supplements you can take that might help that. If you have a valve dysfunction, then it might be even important to wear those real tight stockings, Ted hose they're called, or Job stockings. They're super tight on your legs, And now they have them in colors and things, so you could look like you're wearing some. What's it? You got one on?
Going on right now. Yep.
Is it colored?
No, but now that I know that there's colored ones, I'm probably gonna have to hop on Amazon.
Yeah. It used to be all they had were those white ones, and you walk around and look like they're old lady stockings. Yeah. But that's another thing is if you put back pressure on those veins, and then it helps to push the fluid up. Now, you don't have to take the diuretic if you're dehydrated in another way. So if you diminish your water intake and just don't drink as much water, so drink only when you're thirsty, drink smaller amounts, and get most of your water from food. So if you're eating fruit, vegetables that come with water, they're mostly water. Like, if you look at celery, celery has, this much fiber and this much water. And lettuce is the same way, and cucumbers and all that stuff. So if you're eating a lot of foods that are high in water, then you won't have to drink very much at all. And you just keep yourself a little bit dehydrated, so that you're not collecting water in your legs.
All right, this is good. I'm doing a lot of icing right now, and I feel like that helps too. Let's see here. Are there any serious side effects with glipizide?
Yeah, well, the major one is glipizide is something that tricks your pancreas into putting out extra insulin. So instead of making this much insulin with a meal, you make this much insulin with a meal. So it's supposed to bring your blood sugar down, but it actually over time makes you more insulin resistant. So the major problem with glipizide is the immediate effect of, instead of making the amount of insulin depending on the food, you make twice as much or more than you need. And so you can get hypoglycemic, low blood sugar, which by itself isn't a bad thing unless you get really low, like in the 20s or 30s. Then you can actually do damage. But so it can make you hypoglycemic, and it can make you feel bad in the short run. And then in the long run, it can make you more insulin resistant. I don't use it anymore. And that's one of the first ones that I take people off of, because if I'm going to put them on a program, I don't want them to be making a whole bunch of extra insulin and getting hypoglycemic and having poor control. So I'm going to, if I'm going to tell people how to control with their diet, then I don't want glipizide on board.
Sure. If you're looking for that magnesium spray, you can go to Barton Nutrition. There is a code webinar25. You will save 25%. I put that in the chat as well. But those of you watching on Facebook or YouTube, just so you know, that's where you can go. And a couple of recommendations from some of our friends here on the call. Elliot says Scientific Stretching by Thomas Kurz and the Elastic Steel videos by Paul Zychik at their online site are some good recommendations for stretching. And then we had another one. Meg said Bob Anderson has a fabulous classic stretching book. So this is what's fun, is when you guys give us all this feedback, because that's how we learn. We all get to learn together. So
so where I got it was the Elastics website, and that's the man's website, stretching. That's the one I use.
Awesome. This is good. Okay, let's see. Oh, there's so many questions. There was one I wanted to get to. Okay, Andy is asking, what should one expect their blood sugar level to rise during exercise and just after exercise? I ask this because when I exercise, my blood sugar goes up 50 points, but then it comes back down.
Okay. The system that controls blood sugar is not as simple as this much sugar, this much insulin, and this much exercise. There's so many interactive systems that are involved in where your blood sugar is. So and that's one of the things. if you're measuring blood sugar regularly, then you start seeing these anomalies and going, wait a minute, I didn't eat anything and my blood sugar went up. Or I did all this exercise and my blood sugar went up. What the heck? It's supposed to go down with exercise. And yes, that may be true. It should go down with exercise, but not always, because as it starts going down, then your pancreas puts out other hormones like glucagon. And glucagon tells your liver, hey, make more sugar. We're using up our sugar here. So, so then your liver puts out all this extra sugar and your blood sugar goes up. And you're like, it seems frustrating, but don't worry about it. That's actually a good thing, because if you're taking the sugar out of your liver has all this stored sugar in it. If you're taking it out, then you're opening up the way for your liver to be able to take in sugar again and to be less insulin resistant. So it's still working. Don't think that, oh, because my blood sugar went up that it's not working or it's going the wrong way. That's not right. Keep exercising. That's really good for you. And it's really good to use up that sugar in your liver, because that's what will open up the cells to allow the blood sugar to allow the blood sugar to come down to normal on a regular basis, so that it's always normal instead of just occasionally normal.
Okay. Some smart advice here from Elliot. Take an Epsom salt bath for magnesium and juice your salad and drink it for better digestion. Awesome. Okay. Freda says, I should say that since I started the herbal regimen and the diet meal plan on Monday, my blood sugar has moved from the 500s to 216 this morning. And that's from Monday.
Wow.
Wow. That's great.
That's amazing.
Monday, Tuesday. Wow.
Keep us posted.
It works.
That's amazing.
This works. You just
Emily is asking what can be done to eliminate body fat around the stomach.
Ooh, that's
I think
a good
phase
one.
1.
Yeah, that's a great question. Okay, so belly fat, or the omental fat, or the fat inside your abdomen, is caused by insulin. And so when you have insulin resistance, you put belly fat on. So people who have there are a lot of stress, for example, people are high stress people, they have a lot of cortisol, stress hormones, it makes them resistant to insulin. So even if they have low insulin levels, they still make a bunch of belly fat. And they're like, what the heck, my insulin levels are low. And why am I getting all this belly fat? It's because of insulin. So the only way to sculpt your body, so to speak, to get rid of just the belly fat is to get the insulin down to 0. And so let me tell you what makes insulin. Sugar. When you eat sugar, that makes more insulin. When you eat protein, that causes you to release insulin. When you are stressed, that makes extra insulin, or makes you insulin resistant. You actually don't make more insulin, you're resistant to insulin. And when you eat fat, you get resistance to insulin. So fat does not cause you to make more insulin, but it makes you more resistant to it. So you have to be really careful, because some people, I had somebody who was on a keto diet eating only meat. This was like a carnivore diet with only a few vegetables here and there. He was gaining weight and getting more belly fat. He's like, what the heck? What's going on here? Well, his protein is being made into sugar, and that causes a release of insulin. And then the fat causes insulin resistance. You can't put sugar into your muscles. So he's getting more belly fat because of the diet. So you have to be really careful. Again, we talked about this before. Not everybody's the same. So on his case, he needed to do a high fiber diet. So I put him on a raw foods diet, and it actually worked really well. That was an interesting case.
I know you need to leave, but I'm going to piggyback this question from Patricia. I've been on the keto diet for 1 month and I've lost 11 pounds. My fasting glucose level stays around 115. How can I get it to go lower?
Okay. So everything in the body has a set point. It's like, the amount of fat you have on your body has a set point. And this is the way it is. And if you gain weight, you'll lose it easily back down to your set point. Or if you lose weight, you gain it back easily up to your set point. Either way, there's a set point. Well, sugar kind of has the same thing. People who are in the low 200s tend to stay in the low 200s, and their body will just keep them there all the time. The way to change that, to reset the system, is fasting. So whether you do intermittent fasting, where you skip dinner, you just eat breakfast and lunch, or I have somebody doing 1 meal a day, and just eating breakfast, and or if you do like 3 days in a row, it requires about 3 days to reset the system. So just a 1 day fast probably wouldn't reset it right away. It takes about 3 days. So if you do a 3 day water fast, for example, or a broth cleanse or something, you have to be careful. Hypoglycemia often happens when you're not eating anything at all. So watch out for that. And it's not a big deal if you have some hypoglycemia, but you may feel bad. I did that a couple of weeks ago. I was fasting and I got hypoglycemic, and I had to lay down for, I don't know, 10 or 20 minutes, and then it got better. But if you can't, if you're like somewhere you can't, and you're getting hypoglycemic, then if you had like raw carrots or raw, just like one of those little packets of raw almonds is really good. You can eat that, and that'll bring your sugar up, and it won't spike it too much. Like people say, drink orange juice, and that just spikes you and then brings you right back down. Might not be the best way.
Hello. Okay, today's Fixed Blood Sugar webinar is sponsored by Easy Relief Magnesium Spray. Now, this is fast absorbing magnesium that is a topical spray that you spray on your skin. And it is vital for over 300 functions in your body. Now, the nice thing about this magnesium is, first of all, you don't have to ingest it, so you can't take too much of this. Your skin is great at absorbing only what it needs. So you spray about 30 to 50 sprays of this per day, and I personally do it 2 to 3 times a day of 10 to 15 sprays, and I do it on my chest and my legs typically. And this is going to correct the deficiencies that most people have. Now, how do you know if you need magnesium? Usually the symptoms are you have muscle cramps, trouble sleeping, if you're fatigued, if you have erratic blood sugar, if you experience any type of numbness or tingling, or if you feel down in the dumps or feeling blue. Now, those are all different types of symptoms that a lot of times magnesium can help with. So highly recommend this product of Easy Relief Magnesium. It is super easy. You spray it on. You don't have to take a pill or anything like that, and you don't have to worry about absorbing too much. This absorbs quickly. Now, this will get into your body in less than 2 minutes, into the bloodstream and circulating through. So it's a lot faster than if you take a pill with magnesium in it. So it's super important for metabolism, metabolic function. If you have insulin resistance, magnesium will probably help with that. There's a connection between low magnesium and insulin resistance. It's great for relaxation and sore muscle relief. It helps you sleep. Great for muscle cramps and achy joints. There's no sticky residue. So a lot of times if you find a different magnesium spray, it's not bonded with water like this process has done. So this doesn't leave a sticky residue at all. So it's great. It doesn't sting. It improves your mood. And there's just all sorts of different, again, there's 300 different functions that magnesium is used in the body. Highly recommend it. It's 365-day guarantee, just like anything. You can get it at bartonnutrition.com. And if you want to save 25% in addition to our already discounted prices, use this coupon code webinar25 as a coupon code. Again, that's at bartonnutrition.com, and Easy Relief Magnesium. Highly recommend it. Dr. Saunders approved. It's all natural and safe. Get yours today. All right, thanks. Now back to the webinar.
I think it's time Dr. Saunders has to go to his patients, but we could keep you here for another half hour because we got a lot of questions.
Yes.
But we'll let you go, I guess.
Thanks.
Thanks,
This is
Dr. Saunders.
awesome.
All right.
Value
See ya.
this so much. Thank you.
All right. Okay, well, this is when we wrap up the show here, episode number 90. So we're getting close to that triple digits mark here. So I hope everybody has been getting a lot of value out of these calls. And yeah, lots of good questions today, as always, and lots of good answers. And if you had questions that didn't get answered, we'd like to refer you to our YouTube channel, and you can find that. Just go to bartonwebinar.com and click on YouTube. But we've got 89 of these webinars recorded, and we always have lots of questions in there. And I think there's a way you can search as well in our channel to search and find some maybe keywords that you may have questions about as well. So check that out and join us on the next call. Keep joining us, be a part of our community. Come on over to our Facebook group, get involved, keep reading the Diabetes Solution Kit and following what it says, and you will get results. So it's fun to hear people sharing their success stories and their blood sugars going down and energy levels going up. And so it's just fulfilling for me as a business owner and team leader, I guess you could call it, just to know that the work that we're doing is actually helping people. And so that's one of our core values. And Leslie, thanks for joining us through your recovery of ACL. I know you're going through a lot of hard times right now. So hope you enjoyed that Indian food last night. I don't know if you got any or not.
Well, it was sitting out waiting for me. When I got back from physical therapy, I was able to get it. His wife brought some butter chicken over for us, and it was so good. It was so good. It's been nice that we've been able to be helped in that way, because I cannot get around real well at this point. So
yeah, it was good.
One other thing I'm going to mention too, there is a frequently asked questions portion on bartonwebinar.com. I can see there are some questions that didn't get answered. For example, why are my numbers higher in the morning versus at night? We address that on the frequently asked questions. So go there. You guys are going to find a lot of information for the questions that you have.
Yep. So there was a question about feta cheese. And so I would say questions about foods, I would just look at the nutrition facts label on the back. Like I had my beans here, but if you look at the number of carbs and then you subtract the number of grams of fiber, that gives you your net grams of carbs that you can have in a day. So I think feta cheese should probably be really low on carbs, I'm pretty sure. So yeah, but let's see. I think that's about it for today. So thanks for joining us, everybody. Keep up the good work, and we'll see you next time. Take care. God bless.